Mayor Walsh took office in January. One of his first orders was for an assessment of Boston's elderly population. As expected, the population's growing, but the survey brings to light some other changes along with some critical needs. To tell us about the findings is our guest, the city's Commissioner of Elderly Affairs, Emily Shea. Thank you very much for being with us, Emily.
Oh, I'm excited. Thanks for inviting me today.
It's not surprising that the population is getting bigger, but I guess when you look at the overall piece of the city this represents, it does look interesting.
You know, it's so interesting. We know that in the year 2000, we had 80,000 people over 60 in the city. And by 2030, just 30 years later, we're going to have close to 130,000 people. So that is a huge growing population where our older adult population, our senior population is going to go from 13% of the Boston population all the way to 20% of the Boston population. So it's growing faster than other age groups.
And within that age group in Boston, you also have, maybe not a majority, but a very large percentage who are poor, or at least they're going to be poor when they're on fixed income.
Certainly, certainly. So we do have 31,000 Boston seniors who are living on less than $25,000 a year in income. So that's less than right around $2,000 a month. And from that, they have to pay all of their expenses, their housing expenses, their healthcare expenses, food, prescription drugs. So it can be very challenging for Boston seniors to make ends meet in the city. We know that for many, many Boston seniors, their income is less money than their expenses are.
You know, and I looked at those figures, and I'm guessing that, you know, even if you're talking about an elderly couple who bought their house a long time ago, they've already paid off the mortgage, but they still got taxes, they still got to heat the place and do everything else. So it still looks tough even for people like that.
Certainly, certainly. And that's such a small percentage of people, Chris. Only 24% of Boston seniors own their home free and clear. Otherwise, they're paying rent, 48% pay rent, and the rest of Boston seniors pay a mortgage, and only 24% are paying nothing on their home. But you're right, they incur lots of other expenses.
So it means they're going to have a really serious housing problem for this age group then.
Certainly, certainly. I mean, housing is always a challenge. But in our office, we assist people with a lot of housing related issues, and being able to meet their rent or mortgage is one of those.
I guess one idea that people might be considering in some way along the line here is rehousing, because you might have cases where somebody, they're in a house that's very big, physically it's more than they need, but financially changing that might be hard for them to swing.
Yeah, I mean, I think that one of the things that Mayor Walsh wants to do is to look more closely at housing. And so I don't know if you heard, but he did announce a housing task force that's going to be looking at housing, including the specific area of senior housing in the city, and really looking at where do we need to go as a city so that as people age, as other groups increase in the city, we have enough housing for everybody.
Well, another thing that's happened in Boston, especially over the last 20 years, is the increase in the percentage of people from other countries. And increasingly now, we're talking about people, the older generation at least, who didn't learn much English. The kids do it pretty well, but
Right.
The older people never really picked up very much.
Right, right. And we know among Boston seniors age 60 and over, we know that 20% of people either speak English not at all or not well at all. They have very limited English proficiency. We also know that 19% of Boston seniors are living in households where there is no one who's over the age of 14 who actually speaks English well. So 19% of seniors live in households that are linguistically isolated. So what that means for us is that we have to understand that those folks may need increased translation. We have to make sure that we're hiring bilingual staff, that we have the ability to translate into other languages.
Here's another concern is what it takes to allow people to live in homes as opposed to being institutionalized someplace. And I guess, well, what about the considerations for that?
Yeah, so we want to make sure in Boston that we have the support network that people need in order to live in their homes and communities for as long as they can. We have lots of great programs that go into people's homes that help to provide the services that folks need in those homes. And we want to make sure that we keep reaching people with those services, that we make sure that those services are enough to keep people in their homes, and that we continue to be creative, because that's the place that people want to be. We want to keep people in their neighborhoods. We don't want them to have to move into institutions unless they need that.
Of course, if you're in the neighborhood, you also need to get out and get around. And I know this didn't just start with this report, but I guess you're going to have to look at some more ways to make sure there are as few obstacles as possible to getting around.
Certainly, certainly. So transportation is always a challenge, I think, across the entire country in terms of people being able to get out and get around. We have some great resources in the city, like the senior shuttle, that helps to drive people 60 and over to free medical appointments in the city. But we need to look at other transportation options, other ways that people can connect, other ways that community can come together and help each other so that people can get where they need to go.
I guess there's more thinking in cities around the country, if not beyond the country, about things, even standards for making cities more age-friendly, I guess.
Right, right. And one real exciting thing that we're going to be doing at the city that Mayor Walsh just announced the other day is Boston is going to be joining the World Health Organization and AARP's Age-Friendly Cities Network. What that means is we're going to be undertaking a 5-year process. We're going to look first at how age-friendly Boston is in different areas, looking at housing, looking at transportation, civic engagement and employment, all different areas like that, housing and built environment. We're going to assess where we are, we're going to create an action plan for where we need to go, and then we're going to implement that action plan.
All right. Well, thank you very much for being with us.
Thank you for having me.
Boston's Elderly Affairs Commissioner, Emily Shea.